Doctor, congratulations again on your nomination. As I've said before, your nomination is one of the most exciting picks of the entire Trump administration. You showed incredible courage in speaking the truth about COVID-19 when much of the rest of the world stayed silent about it. And free-thinking people everywhere have not forgotten that, what you stood for then. And it's remarkable to see that you're nominated to be the head of the very institution whose leaders persecuted you because of what you believed during that period. I want to start by asking you about COVID. Lockdowns caused irreparable harm to our nation, and they are still harming us 5 years later. What is NIH's proper role in a pandemic, and how did Director Francis Collins overstep that role during his time?
Senator, the proper role of scientists in a pandemic is to answer basic questions that policymakers have about what the right policy should be. Our role isn't to make decisions to say you shouldn't be saying goodbye to your grandfather as he's dying in a hospital. It shouldn't be to say you can't have a funeral because it's too dangerous. The scientists should say, here's what the risks are. And then you decide what the risk, whether you take it. The role of the scientist shouldn't be to say you can't send your kids to school for 2 years, that you can't you should close hospitals so that they can't treat heart attack patients. That you should not the role of scientists should be to address those problems by giving good data, and then let people make the science should be an engine for freedom. Knowledge and freedom, not something where it stands on top of society and says you must do this, this, and this, or else. It shouldn't be pushing mandates for vaccines that have been like the COVID vaccines that were tested for for a relatively short period of time. I took the COVID vaccine myself, but I think that the mandates that many scientists push have led to the lack of confidence that so many of the public has in science. If science is a force for freedom and for knowledge, it will have universal support. That's what the role of science is.
Very well put. You were demonized for co-authoring the Great Barrington Declaration in October of 2020. Dr. Fauci called it total nonsense. Rochelle Walensky called it wrong and unsafe. Your opponents who wrote the John Snow Memorandum said it could harm 500,000 people. Reading what you wrote in the Declaration, you were undeniably right about all of it. You wrote, quote, current lockdown policies are producing devastating effects on short and long-term public health. Doctor, what does the public health data tell us today in the aftermath of COVID-19 in 2023 and 2024? What does that data tell us today?
Well, Senator, first, millions of children were out of school for years. The rates of suicidality and depression are through the roof. Learning loss will have consequences throughout their entire life. There were people who skipped their cancer screening, who have late-stage cancer now that should have been picked up earlier. There's the trillions of dollars we spent that actually caused the inflation that we still suffer from. The UN, early in the pandemic, estimated almost 100 million people would face starvation as a consequence of the economic dislocation caused by the lockdowns. This is devastating. This is devastating policy that didn't need to happen. The Swedish example, for instance, where there's lower death rates, all-cause excess death rates in Sweden relative to their neighbors, including Norway, including Germany, which locked down more, is an example that we didn't need to do the lockdowns. Florida having lower all-cause excess death rates than California, again, is an example where the lockdowns did not save lives, but had tremendous consequences on the well-being of the poor, the working class, on children, and the vulnerable.
Yeah, I want to read a little bit more. You said in the Declaration that, quote, keeping students out of school is a grave injustice. Now today we see student achievement and grades well below the pre-pandemic levels. You also wrote that, quote, young, low-risk adults should work normally rather than from home. Restaurants and other businesses should be open. Arts, music, sports, and other cultural activities should resume, end quote. Now we see many communities and cities are unsafe today and have been dramatically changed because of the lockdowns during COVID. In a nutshell, Doctor, what would you have done? What would you do differently now than what these obviously ill-advised leaders at NIH and otherwise and other places do? How would you have done it differently in a nutshell?
Well, I still would have opposed the lockdowns, but if I'm confirmed as an NIH director, the kind of thing I would have done is I would have allowed there to be scientific debate and discussion. There's tremendous uncertainty what to do during pandemic.
Thank you. I yield back.
We need debate.
Thank you. Dr.